Dr. Jackson, you have served as his personal physician, so let me read this. CNN Health is talking about what the risk could be to the president, and so separate fact from fiction for us here. They say he's in a high-risk group simply by his age, 74, and because of his weight. He's clinically obese, and that's a risk factor for a more severe form of the illness. According to the CDC, people in the 65 to 74 age range face a 5 times greater risk of hospitalization and a 90 times greater risk of death from COVID-19 compared to young adults between the ages of 18 and 29. All right, Dr. Jackson, this is a very active guy. He keeps a breakneck pace that it's hard for anybody to keep up with. What do you make of those odds, those numbers as applied to this president?
Well, those aren't accurate in his particular case, Shannon. I'll tell you why. Because I'm familiar with his health, and I know quite a bit about his physical condition. And he's in great physical condition. He doesn't have any comorbidity, so he doesn't have any heart disease, lung disease. He doesn't have diabetes. He doesn't have any immunocompromise. He doesn't smoke. And so what they're not telling you is they're grouping all those people together. But if you look at people that are exactly in the president's category, 74 years old with no other comorbidities other than they're making a comment about his weight, but most of the people in that category, 74 years old, are also in that category. So these are people that are exactly like the president. Actually, 99.5% or more of those people, when they get this virus, will recover from it spontaneously without any issues whatsoever. Most of them won't even know they got it. The ones that do will get minor symptoms, such as what the president is reporting to have now, with just a little low-grade fever, a cough, and maybe some nasal congestion, but will go on to recover from this completely. And that's fully what I expect to happen with the president.
All right, Dr. Jackson, quickly I want to ask you, because I think that you may have had something to do with the setup over at Walter Reed so that the president, whomever that president is, can work there, stay under observation, can get treated. Can you tell us anything about the setup at the hospital?
Yeah, it's a great facility, and I was involved in restructuring it. We completely renovated the entire thing and built it up. And what it is, Shannon, is it's part of the contingency plan for should something happen to the president. And it's a ward that's dedicated just to the president of the United States. So you go in there and you can do all kinds of stuff in this ward. There are hospital rooms in there. Some of them are ICU type rooms. Some of them are regular hospital type rooms. They have access to all the specialists, to radiology, to lab, things of that nature. So that the president can get secure care. And, there's areas where the Secret Service can post up so they can secure the place. But more importantly, there's an area of that wing up there that's set aside to be like the satellite West Wing. So there are offices up there for the chief of staff, for the national security advisor, for the military aide, for the doctor, for the press secretary. So the business can carry on as usual without missing a lick while the president's up there. And that's one of the reasons he's up there, is because access to that care. We can do things at the White House like get a chest x-ray, which he probably needed, right? But we have a portable machine. We need a good chest x-ray. The portable machine doesn't give us the resolution that we need. So he goes up there, he can get access to the radiology services that he needs, to the lab. He can have a nurse that can check his temperature and keep an eye on him, but he can also bring his staff up there and continue to work, and I think that's what he's doing. I don't suspect he's going to be up there more than a couple of days, and I think this will start turning around. He'll be back at the White House.